Hi there. Imagine losing years of your life to debilitating pain, chronic exhaustion, only to be told that multiple surgeries are your only hope. My guest today defied those odds, trusted her own intuition, and forged her own path to a full recovery. I'm Raelan, and on my channel and podcast, we explore incredible recovery journeys from people who have overcome conditions like CFS and Long Covid, fibromyalgia, POTS, and more. Each story is unique, offering valuable lessons on what it truly takes to heal and reclaim your life. Today, we're joined by Dr. Satya Sardonicus, a chiropractor and neurobiology expert who spent her 20s battling fatigue, fibromyalgia, plus so much more. And rather than accept a future of surgeries, she pioneered the Neurofascial Flow method, a groundbreaking approach that not only healed her, but is now transforming hundreds, if not thousands, of lives. So right now, we are talking about a recovery approach that we have never talked about here before. Not only will Dr. Satya share cutting-edge research and walk you through right now simple strategies to try, but she is also a beautiful person who you're going to love. Stick around because we are going to walk you through some great stuff and have a lot of fun while doing it. So let's dive in. Dr. Satya, amazing to have you here today. Thanks for doing this.
Yeah, so glad to be here with you.
So I know you have a really complex and honestly quite terrifying sounding health history with different conditions over the years. So it's impossible probably right now to sum up all of it, but for our viewers, our listeners, can you just tell us a bit about some of your health journey to date that's brought you to the work that you're doing now?
Yeah, absolutely. It is. It's kind of crazy when I go back and read my old health histories or my exam forms. It makes me cry because I just forget how absolutely terrifying it was. I struggled with chronic headaches, fatigue, nausea. I was told I had the worst adrenal fatigue at the youngest age when I was 16 years old, and nobody knew why. And it wasn't until I was in my mid-20s, after I developed a ton of muscle weakness and heart rate problems, dysregulation of my nervous system, that somebody was looking for MS plaques and took an upright MRI instead of laying down, just because that's what they had. And they said, oh, actually, your brain is herniated out the base of your skull. And we had before that thought I was just dying in my early 20s. My parents, all my doctors, me. It was really scary. I had a lot of progressive, weird neurological symptoms. And then they told me I needed to have brain surgery to cut off that part of my brain, I don't need it, or cut off the back of my skull to try to decompress it. There's one surgery that wants to cut the attachment of the spinal cord and tailbone. And I was like, first of all, they just sound barbaric and terrifying. And then being that I was almost through my doctoral program at that point, I went to PubMed and I looked at what are the outcomes of these surgeries, and they're not great. And I said, okay, well, sometimes they help for the first 6 months and then people get worse. So what are they trying to do? And I figured out what they're trying to do mechanically, and I applied my, at that point, education in pediatric chiropractic and craniosacral and other types of non-invasive manual therapy. I said, how do I do the surgical outcomes non-invasively? And using me as a guinea pig, I went from having 40 what we're called drop attacks, or it's I collapse. Now I think it's a dorsal vagal collapse that my body was thinking it needed to play dead, but all my muscles would just collapse. I'd drop to the floor like a sack of potatoes and had trouble breathing and speaking. And it's common with the diagnosis of POTS, which wasn't so popular back then, so I didn't have that diagnosis, but what I know is yes, I would have been diagnosed with that as well. But I went from falling 40 times a day to once every couple of weeks within a matter of 3 months. And that grew into the work that I'm doing now, Neurofascial Flow, which is about reducing tension on the spinal cord, reducing compression on the brain. And it's relevant not just for people with that condition, which we can talk about is actually really, 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 really common and gets misdiagnosed as fibromyalgia, chronic fatigue, POTS, functional neurological disorder. There's a lot of diagnoses people are running around with from their doctors that don't help them get better that are actually caused by this condition that gets missed. But I did a lot of that recovery through the fascial system, but I was also specializing and working with kids with autism, dyslexia, schizophrenia, Tourette's, like neurosensory processing difficulties. And I was like, wow, they have a lot of similar symptoms to me. And also they're stressed out parents. And I was like, oh, the intersection has a lot to do with that chronic sympathetic dominance when the brain and the nervous system go into a very appropriate, intelligent, adaptive response of being in alarm mode, but it causes a lot of changes to our physiology that get called illness, that make us think that our bodies are broken. And so I ended up saying, okay, well, how do we normally come out of that dysregulation? And ended up developing exercises that helped regulate my nervous system. And then I've been able to help other people with and without this particular head injury to get more, to really restore the body's ability to heal itself, which is a completely different thing than how do I fix XYZ symptom or treat XYZ illness. It's like, well, the body knows how to heal, and if it's in an adaptive state, we got to get it back into healing mode before, maybe we do need outside help. But if the foundation's not working, then you can do all of the meditation and foam rolling and supplements and any kind of, juice cleanses and whatever targeted therapeutic treatments that might be helpful, but they won't help enough if the foundation's falling apart of your nervous system being dysregulated. So yeah, that all very much grew out of my own health stuff, as well as just taking care of other people who have chronic illness, who've been told, there's no help. This is just your life now. And I don't think that's true. I don't accept that.
So you mentioned things like the autonomic nervous system and our threat assessment system, which is something that I think many of our viewers are becoming at least aware of. Many of them are expert level by now.
It's amazing. But I look on Instagram and there's so many people talking about nervous system regulation now. I'm like, this is great that it's more in the awareness. Yeah.
It absolutely is. One thing you're talking about is the fascial system and the role of that and all of this. So can you explain for people, what is that?
Yes. So first of all, fascia, like most people can know that you have your plantar fascia, like plantar fasciitis, when the bottom of your feet hurts. But there's fascia in the whole body. It's literally everywhere. It's the scaffolding. If you get a cut of meat, there's that tough white stuff on it. They've cut most of it off, like when they do the butchering. But in our body, everything is suspended and entangled and enmeshed in this spiderweb-like material called fascia that literally maintains the relationship, the structural relationship, like scaffolding of the body. So all of your bones, all of your organs, all of your muscles are enmeshed in fascia. And just like here, I actually have a fun little prop right here. These little kid toys that you've probably seen, where the rigid pieces aren't actually touching. The reason that this is in the shape it is because of the elastic, which is continuous through the whole thing. And when force comes in and distorts it, the elastic disperses the force across the whole system, and then you let go, and it should come back to normal. And the fascia is what is elastic in our bodies, where it's like, these are our bones, and this is the fascia with the muscles inside, that allows us to take a hit or fall down and come back to center unharmed, ideally. But it can get sticky from injury, from the food we eat, like chronic inflammation can make more stickiness. There's a lot of things that can make the fascia get stuck. And if it gets stuck, then one, you're more prone to physical injury. But the thing that matters more to me and probably to you and our listeners here is that it will distort the nerve signaling to your brain. So your brain needs the signals that come from your fascia, your joints. It's called proprioception, and it tells the brain where you are in space, but it also is how you recover from a stress response normally. So like if you smash your finger, you want to shake it and squeeze it, maybe curse. I actually read a study recently that cursing also reduces pain. Like they actually showed that it does, which I think
I've heard that. When I told me because
I say that all the time. Like I make that joke that like, oh, maybe you're going to curse, but you're also going to shake it and squeeze it. But they showed that cursing also brings the pain down, but so is squeezing and shaking. The movement comes and triggers those
Right.
proprioceptors, those signals that are in all of your soft tissue and joints. And
See, but my husband uses the cursing because he loves to curse for everything. So any piece of research he finds that says
he's
it's good
right.
for you, he's like,
He's like vindicated. No.
that's one instance. You didn't just stub your toe. Like you're watching.
Yeah, I don't know.
Any
I don't know if it works just like with depression or something. If you just start cursing, if it reduces your.
threat.
They did show it if you stub your toe.
Okay.
In the moment. In the moment. At least that's the research I saw. If he wants to send me some more, I'll gladly look at it.
Okay. It's not blanket permission to curse as much as you want whenever you want because yeah, okay.
I
You
mean,
hear that, Jeffrey?
life, but
Anyway, I digress. Back to the fascia.
it's all good. So the fascia system has these receptors in it, and if it's stuck in any way because you sit at a desk all day or you had an injury a long time ago that you don't think you have any lasting effect from, but maybe you have some scar tissue, which is fascial adhesions, or you have like endometriosis is fascial adhesions. So there are some times that we get diagnoses that actually say you have fascial adhesions, whether or not they use that term. But a lot of the time we just have stickiness, like the rib cage gets really gluey to itself with chronic stress. I've noticed, like with my patients, this is just an observation that I've seen. Every single person that I could tell their nervous system was in a heightened alarm state for a long period of time, they also had a lot of stickiness between the rib cage. So if I took like a measuring tape and tried to measure how much your rib cage moves with breathing, it wouldn't move very much. And instead, you probably have a lot of neck tension because these muscles are trying to help you breathe, or your diaphragm has issues because you do a lot of belly breathing. But the rib cage gets really gluey to itself, which obviously makes breathing more challenging. But it sends alarm signals to the brain 24 hours a day saying, help, I'm stuck. And even if nothing else ever stressed you out, the fascial adhesions could actually perpetuate an alarm response, keeping your brain in that alarm dysregulated state.
This is fascinating because we're always trying to figure out all the reasons for why our brain or our autonomic nervous system
It's
is
like,
getting
why is it
alarmed
dysregulated?
and giving us these signals. And we say, oh, it could be things in your environment. It could be hypersensitive. It could be
Mold, parasites.
anxiety. Yeah, like it could be all sorts of like you're just on, overdrive, high alert, constantly. But this is a whole other element of it because we talk about those miscommunications happen between the body and the brain, but then trying to understand how is that happening? Like, what does that look
Yeah, and
like?
it's not broken. The fascial adhesions are usually actually the body trying to brace and splint and protect itself, either at a time that you had an injury and it was trying to protect, or my theory about the rib cage thing, because I've seen it so much, is I think the brain might be trying to like make armor to protect your vital organs. But regardless, like that's just my theory about why we have so much rib cage adhesions in people who have chronic stress. But I'm sure like postural things play a role as well. Like if you're chronically at a computer or hunched because you have a lot of anxiety, and we go into that protective mode. Regardless of the reason, we get into the physical stuck state, and it actually mirrors into our neurological resilience. And it's not the only thing. Like all the other stuff we were talking about, still valid, can absolutely contribute to your brain being in this dysregulated state. But the physical piece is something that gets overlooked so much of the time. And it's a lot easier to, like, you can't, if you're already in a downward spiral and you're stressed out, like, how much do you want to go and meditate? Like, or do your self-care, anything, go exercise, do anything. So I was like, all right, how can I make this change with like the lowest effort possible? And the fascia gives us that window because you have such a fast response. Do you want me to show you like my favorite way to interrupt the stress spiral?
Oh, yeah.
It literally
Absolutely.
takes like 10 seconds. So it's going to seem so silly simple. You're going to be like, yeah, whatever. But it's crazy. Like, you just do deep squeezes anywhere you can reach, because the receptors are everywhere in the body, but they're in the joints as well. So I squeeze the hands. It's not like a massage. It's like I call them squeeze hugs because it should feel like a hug. This is why, like a good hug feels really calming. And you can see my See how my voice, like the tone of my voice dropped and the speed I slowed down? I didn't even, that wasn't on purpose. That's
Oh,
because it that quickly just, I was getting excited and buzzy, but it like downregulates your nervous system pretty immediately. Well, downregulates isn't quite the right word. It helps you come back to a sense of safety. And so if you've gone past fight, flight into freeze, like functional freeze, where you're in a more dissociated state, the same thing will help bring you up out of it. So it really helps restore regulation.
I don't want to stop doing it. I think I'm just going to do this the whole interview. I hope
I
you
know,
have It feels incredible.
right?
Wow. You just explained how hugs work. My head's exploding.
Yeah. Yeah. This is, I actually,
Okay.
I'm going to tell you a really fun, quick story. I had a woman call me years ago on like a Friday night, and this was not a current patient, but she wanted to bring her baby in. She's crying. She's like, my baby, like, I think the baby was a couple, like 4 or 5 months old, and it wouldn't keep food down. It wouldn't sleep more than like half an hour. It was just crying, like colic, really intense, and was underweight because it wasn't latching, and there was a lot of difficulty. And I was going out of town to teach a seminar, so I was like, I literally can't see you and your baby until Monday. And I talked to her on the phone, and I was like, listen, do this to your baby. And I taught her how to do the little squeeze hugs. And even when you're doing it on a baby, like there's a decent amount of pressure. Like my fingernails blanch a little when I do it. See, but I'm not using my claw fingers. It's a very broad thing. But I was like, do this to your baby, especially like the feet have a lot of the receptors, so you can just do it on feet and legs. You can do it, you can walk your hands on the torso, whatever. And she called me the next day because I gave her my cell phone. She called me the next day and she's like, my baby slept like 6 hours last night. And then she nursed this morning. It's gonna make me cry now. Like it's
Oh,
it's not that that's the only thing that baby ever needed, and it's like taking a vitamin that is just like a stopgap. This doesn't, basically, if you have stuck places anywhere in your body, then the brain is starving for proprioceptive feedback. This supplements your brain with some proprioceptive feedback so that you can, for now, get out of that stress loop. So you can use it anytime you get feeling buzzy or anxious or depressed, or you have elevation of any of the symptoms of your chronic pain or illness. But you can also do it before you're going to go into a stressful situation. It will prime your nervous system to be more, to have better capacity to function cognitively. Like your ability to understand other points of view are actually neurologically suppressed when you're in alarm mode. So it helps you like be more compassionate going into a mediation or something. But ultimately, you're going to need to figure out why your brain is starving for the proprioception and unravel the stuck places from your body.
this is fascinating. And I'm thinking, why aren't more people talking about this? But then I also think 5 years ago, I wasn't hearing anyone talk about the nervous system really, or the limbic system, or the
Right?
amygdala. It's
Yeah.
really taking some time for them stuff to trickle down.
It is. It takes
So
on
what
average
is,
like 17 to 20 years for something to get from the scientific literature into clinical practice.
yeah,
20 years.
horrifying. I'm hoping that things like this speed that up. I'm
Well, that's
working
why,
on it.
yeah, I mean, that's why I've even, I'm not a researcher, I'm a clinician, but I've published multiple studies just trying to like bring it more into the research world. And also, it's why I'm already teaching this stuff right now, because I've done some preliminary studies. I've seen it work really well, but I'm like, we can't wait. We can't wait for somebody to do like a 500,000 person study or something. That's a bit excessive, but
Yeah.
it's not that why people aren't talking about it. I don't know, because it's just common sense, and it's just stuff I learned from like reading physiology textbooks. Like we already know that proprioceptive feedback downregulates the autonomic like sympathetic overdrive specifically. We've seen multiple studies showing like dance and cognitive function and movement therapy. Like we know there's a lot of extrapolation that's been done in different studies, but yeah, it's not coming through to the general person. It's mostly being talked about right now in clinical circles and just starting to get out to individuals. And that's why I'm here with you, and I'm doing all these speaking engagements, because I'm like, I got to put this power back into people's hands, because the majority of the results that I was seeing in my clinical practice for the past 15 years were things that I would teach people they can do at home. There's so much you can do to unravel your own fascial adhesions at home and to regulate your nervous system. But there's a lot I'm seeing out there, I gotta say, that is, because it's becoming trendy, that there's some incomplete information that's just doing like the nervous system regulation without healing the underlying fascial stuff. Or there's people talking about releasing fascial adhesions, and they're just like tearing through it, where that can be really re-traumatizing and cause more dysregulation to release the fascia without any regard for the nervous system. So that's why I've put those things together. I've synthesized them, and I try to help people move through the process in a way that's more in partnership with the nervous system and with the body.
So for people who are listening or watching and they're currently facing long COVID or POTS or chronic fatigue syndrome or something along those lines, how do they know if this fascia connective tissue situation is a problem for them? And what are the next steps for them from here? Like, how does this incorporate into their recovery exploration journey?
Yeah, totally. I'm so glad you asked, like, how you can know if that's going on for you. Literally this morning I was in the process of, and so I'll have to send you another link, but putting together, I'm losing my train of thought here. So I have an online membership where I help people move through this process and apply Neurofascial Flow method. But there's a section at the beginning that is all of the self-assessments that I teach, and I'm pulling it out and just making it a free resource, because I think that we have too much power has been like taken away by doctors who say, I'm the one that can measure things, I'm the one that knows stuff. And I mean, I can teach you one thing, right? I already told you about the measuring tape. Anybody can do that. Take just a flexible measuring tape and go and measure how much your rib cage moves when you breathe. Like, measure the breath all the way out, and then the diameter or the circumference when you're breathing all the way in. And it should be at least 2.5 to 3 inches difference. And I will see people with half an inch difference or 1 inch difference. And that tells me you have fascial restrictions in your rib cage. I've seen people with 0. Actually, after a car accident I had, 10 years ago, for about 6 months, it was 0 on my own rib cage. And that's actually, after that is when I figured out how to make a lot of the fascia releases DIY, because I had just moved somewhere I didn't have providers. And I was like, okay, how do I do this work on myself? And that's what the online membership has, is all of the like follow along videos for fascia release that don't damage your body. But there's a nervous system one I can show you right now too, if you want.
Yes, please.
Okay, so peripheral vision gets reduced when you're in fight or flight mode. So normally at rest, and you have to tuck your hair behind your ears for this, you should have, maybe I need to step back. I'll be down here. So ideally, like when people do this at home, I tell them to go stand in a doorway or something so that you know that you're flat against the wall. But basically, at 180 degrees, you should be able to, with your peripheral vision, that is looking forward, but with your side vision, be able to see both thumbs. So the test, I tell people to either stand against a wall so you're exactly 180, or just go a little bit back. One hand at a time. You got to do this in front of like a mirror or a camera like we're doing or something, so you can
see that doesn't have normal pants on. I mean, she's like a outfit on. Okay.
I know, I got my leggings too.
Okay.
So 2 thumbs up. Now, you're going to watch right in front of you, like watch your nose so that you know you're only using peripheral vision. And one hand at a time, bring your arm forward until you can see your thumb. Not just a blob, but your actual thumb. And stop once you can see it. And then do the same on the other side.
Oh, does it have to be clear? Can it just be a blurry vision of a thumb?
You don't want it to be a blob, but you should be able to tell that you have a thumbnail.
Okay.
Yeah.
And I should be able to do this at what point? So I'm about here.
180.
Wow.
So, when I have people do it at home, I'm like, do it in a spot where you can be like, okay, it was this point on the wall or something. When I do it in my clinic, I measure with a goniometer, a special measurement instrument, but you're looking at how many degrees forward from 180 you are.
Yeah.
And
Wow.
if you're forward like that, that tells me, like, right now, there's no threat, right? We're here, we're chatting, we're having fun. Like, there's no logical reason for your nervous system to be in an alarm response, which it is if your peripheral vision's reduced. But that's a normal thing to happen if your brain thinks your life is in danger. Okay? That's why we get our peripheral vision comes in and we're more jumpy, we're more reactive. We look around
That makes
us,
sense.
right?
That makes a
So
lot
that
of
tells
sense.
me right now that your nervous system is in that elevated space.
Wow.
Now try this. Let's do some squeezes. Do some squeezes. And also, I'll show you one more thing you can do. I call this a seaweed wiggle. This is the side seaweed. Because I want you to imagine that you're made of seaweed. Your body is seaweed and you're underwater.
Okay.
Oh, where? There's a wild glare when I move back here. Okay. And your sit bones are like planted in the sand underwater. And you're between two panes of glass. So you're not going to go forward back. It's just sideways. Sorry for the weird glare. There's some. And I want you to see if you can flow just side to side with your head being the last thing. So it's from the bottom up in your spine. Can you float side to side? Let your head complete the wave. Let your head, there you go. And other side.
Oh, I see what you're saying. All the
There
way
you go.
over.
Yeah. But I want you to notice, are there places that's sticky? Like what's really common is to actually,
Everything.
yeah. What's really, and if
Oh.
it hurts, don't do it. Like stop. If this
It doesn't hurt. It.
yeah, if this is
Tense.
irritating symptoms, don't do it. It's actually
Okay.
both an assessment and a therapeutic, but you got to do it in different ways. So pause if it's hurting you and let me explain.
It feels good.
Yeah, we'll do it smaller. So it's therapeutic if you do it so super small. Like I want you to see how small, like 10% how big you could do it. But can you actually articulate through all of the joints in your spine? Because what's really common, especially because of all that rib cage adhesions, is we'll start going and then from like here to here wants to just move as a single and then your head wants to flop. And if that happens, I can almost guarantee you have chronically tight muscles in your shoulders and neck because one, they're trying to help you breathe. Two, they're trying to stabilize your floppy head when this isn't moving. So remember, the fascia should be helping force disperse evenly across the system. But if your rib cage is all gluey, now your head or your neck has to move extra, it feels vulnerable and your brain wants to protect it with muscle spasms. You can get a massage all day long and it's going to snap right back to tight as soon as you get out of that massage an hour later because your brain goes, no, I need those tight muscles. They're like you just took away the crutches, the splint, the brace that I was using. So,
and everything we need, you said, is in the links that we've got in the description here. Okay, I'm going to be checking those out as well because I'm pretty sure my fascia are a mess.
It's really common and it's wild. Nobody's paying attention to this. And I'm like, okay, hang on. Like the people paying attention to it are the people who have musculoskeletal complaints. Maybe they've found a provider who treats their neck pain and back pain and they hopefully pay attention to fascia, not just joints and muscles. But the thing is, you asked about your listeners with POTS, with like fibromyalgia, with nervous system dysregulation, with MCAS, with long COVID. You ought to be thinking about your fascia as well because the fascial adhesions can distort the nervous system and keep it in that alarm mode. And you might think, oh, let me get in there and loosen this up, but that often actually triggers more of a protective response. And what I've found is that, like pulling your stockings up from the bottom instead of the waistband, we actually need to start with the fascia from all the way from the bottom. There's this entire connected structure of fascia from the lining of the skull, the dura mater, which is the protective layer around your brain that's like tough fabric. So it lines your skull and spinal column, attaches to your tailbone, and goes out through ligaments like from your tailbone to your sit bone into the fascia in the back of your legs and into your feet. And that whole dural fascial kinetic chain needs to have the tension alleviated from the bottom up because this is often compensating and like counterbalancing and fighting with distal tension places. So the order is really, really important. And the ability to like find your nervous system's tolerance to change is the most important thing. That this is why most kinds of body work can be really triggering, especially if you have any of those symptoms. is because it's trying to force change on your body when it's in defense
Mhm.
mode, it's in protective mode, and that's
Right.
really inappropriate. And at best, it's just going to mean you have to keep going and getting the same massage or chiropractic adjustment or PT or whatever over and over again. But at worst,
Mhm.
it's actually going to cause more nervous system dysregulation.
Okay. So if not done correctly, or if done too much, too fast, this could cause symptom flares. This could
It can
cause,
boomerang your symptoms.
yeah.
Yeah. And I mean, we even had someone in our group inside the chrysalis is the name of the community, because I don't know if you know this, but a caterpillar actually turns liquid when it's inside the chrysalis. 100% liquid.
No.
It doesn't grow wings. It turns liquid. Yeah.
What?
In order to turn into a butterfly. And the thing is, like, how many of us have had our lives upended with some kind of trauma, whether it's physical or emotional or chemical, like
Yeah.
too much, like changing all the carpets and wallpaper, whatever. But you have some kind of trauma, it feels like your life is falling apart. Trauma is like complete destruction, but transformation always comes with destruction. A seed explodes in order to sprout into a plant. A caterpillar turns liquid, but when we have trauma, we get freaked out, we brace, we splint, we freeze, and that's normal and appropriate. But you have to find your way back to liquid in order to reorganize into your next iteration. You have to get back to liquid, and it has to be done in a safe space. And that's what inside the chrysalis is for, is a container in which change happens. And you can apply any kind of cool other techniques for releasing things that you learn, because inside the chrysalis, we talk a lot about the process for cultivating change in your body in a way that feels safe, and even changing your brain. Like, we've seen massive changes in people's like breakthroughs with their psychotherapist, or trying to work on changing core beliefs, because beliefs are the same as physical stuff. If your body's in defense, it's not going to be in growth and healing. And this work is really about how to get your body back into self-healing mode and have it be receptive to change, so that whatever cool techniques, whether it's the fascia releases I show you or what somebody else teaches you, plug into this container. Yeah. But we've seen a lot of, I think, sorry, I got off track, but all good things. But what I was trying to say is, there was someone in our group who was trying to do this seaweed move, and she was doing it following along at the speed of the video I had. And she said it elevated her POTS symptoms. And I said, that means you need to either go slower or smaller, like I was telling you a few minutes ago. Like, try doing it
Mhm.
much, much smaller, because the articulation of the joints is way more important than how big you do it. Way more. So we talk a lot about like how you can modify and adapt so that you don't exceed your nervous system's edge. And that's a very different metric than like, can I tolerate the pain of XYZ thing that's supposed to be the right thing for my body.
Right. That approach of do more, do bigger, do that I go at with everything.
like, like there's this crazy idea that is very Western, very masculine, that's like, you gotta push through, like, no pain, no gain, right? Like, you get bigger results from bigger effort. And I think the most common thing that I'm teaching providers, like healthcare providers, when I show them how to do this work on someone else, I'm like, you gotta go lighter, 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 like, do less. And fascia, because it has such a strong protective function, it's not just that you can accomplish a lot with a short amount of time, it's that you need to do frequent short sessions rather than doing stuff too much too big, because it will want to snap into a protective response if you exceed the nervous system's ability to process that change. And so we do a lot of like, how can you tune into your nervous system? How can you tell what your specific physical tells or signs of the nervous system going into sympathetic? Because it's different for different people. Everybody, there's like themes of constriction versus expansion, but what you feel in your body when your sympathetic nervous system starts to engage and go into protective mode might not be identical to what I feel or someone else. And so that's part of what we do, is really learn how to read your body's signals. That way you can customize literally any method or technique to what your nervous system needs.
Once people use this to work through their nervous system dysregulation, or however we want to term it, and they get to a place where their symptoms have subsided or gone away, is this fascia work type of work that should have some sort of level of maintenance for the rest of your life?
That's such a good question. I think of it a lot like I do with my nutrition. So, have you heard that exercise has actually it's so important for your brain that scientists are saying it might be more important for your brain than it is for your heart, lungs, or muscles? Have you heard that? It's
I have
actually
not.
it's actually a nutrient, this proprioception specifically, that comes from doing exercise. Although most exercise sends both proprioception, happy signals, and alarm signals because you have some stuck places you're wrenching down on. That's why I made these exercises that only send proprioception. But oh, I get so excited and I have so many things to say. What was I answering? Oh,
Do we do this for life?
thank you. So your brain requires air you have to breathe, glucose you have to eat, and proprioception you have to move. Those are nutrients that your brain requires to function. So the fascia work I think of kind of like if I had a lot of buildup on my teeth, I would need to go and get a cleaning, a dental cleaning, and it might take them extra long if I've never gotten a dental cleaning. But then I still need to brush my teeth every day. So
Mm.
you might go through, if you have stuck places in your body, you're going to go through a process that could take, I don't know, 3 months to a year, depending on what is going on in your body, what you've had, of clearing out the old gunk. But then, yes, there's some kind of like maintenance of brushing your teeth, but it takes, I don't know, I spend probably 5 minutes a day. Yeah. So the maintenance I do think is important to keep movement going into the brain and keeping, like, there's also nutritional things that help keep your fascia hydrated. So there are some very simple maintenance things that I put all of that into the program. But it's even in the release time when you're going through like the corrective of trying to unravel your old stuff, I still don't spend more than 10 minutes a day. And I don't recommend my patients spend more than 10 minutes a day. Maybe once a week you do like a 20-minute session, but it is all very manageable and bite-sized, and it has to be, because especially if you're dealing with chronic illness and chronic pain, like, I mean, I know I did for a long time. I had so much muscle weakness at one point I couldn't run 5 feet without collapsing. It was crazy. But these exercises and these fascial releases are really designed for literally any ability to be able to make progress in just a few minutes a day, where other exercise or other kinds of body work might be too triggering.
That makes a lot of sense. And it's like everything else with recovery that I've found that my guests have shared, it never really stops. It might be a little bit bigger of a focus and while you're going through your recovery, but a lot of this is just about helping your body to thrive and helping it to work the way it should.
Living life in a human body, we have stressors. We have like, you're gonna brush your teeth, you're gonna do a little bit of flowing. I don't even know that I do like a dedicated 5 minutes every day. I do it throughout my day. Like, it's become a habit where I'm like, oh, I'm sitting at a red light, I'm just gonna do a little bit of flowing, or I'm doing some stretches in between my sitting and I just do some of the fascia release flowing. And it's like very integrated. So it doesn't need to feel like a chore. Like, oh, I have to go to the gym for an hour 3 times a week,
Yeah. I
Yeah.
love that. Okay, so you, Dr. Satya, had talked about how, things like neck pain and head injuries, maybe people don't know about them or they have an impact on health that people don't realize. So can you tell us a bit more about that?
Yeah, there's a really crazy stat around hidden neck injury, which is that 1 in 20 people with neck pain, no other symptoms, just neck pain, have some degree of brain herniation. The brain is actually herniated out the base of the skull. And
Wow.
1 in 20 people. But here's the kicker, is that study was done with neck pain, but neck pain isn't the most common symptom. Headache is the most common symptom, and we haven't had that study done. And it can be asymptomatic and triggered to become symptomatic by something small, like misjudging the edge of the sidewalk, like bonking your head getting in the car, things that we might not even count as a head trauma or head injury. But what I've seen really commonly is that people who had some kind of head injury as a kid, whether they were just running around, fell out of a tree, the parents were like, whatever, you're fine, or they went to the hospital, like, you have a concussion, go home and sleep it off, rest. But if you've ever had a head injury, if you've ever had whiplash or a concussion and you have neck pain now, it goes up to 1 in 4 people with neck pain.
Wow.
1 in 4. It's really, really common. And here's what it gets misdiagnosed as: chronic fatigue, fibromyalgia, multiple sclerosis, especially early when they can't find any plaques yet. That's what happened to me. They're like, you probably just have early MS. Functional neurological disorder, POTS. There are so many diagnoses that we don't know what's going on, don't know what's causing them, that can actually be linked back to this specific condition. And it's called Chiari, Chiari, if it's more than 5 millimeters herniated. So there are so many people. This is actually, my TikTok just absolutely like went viral, insane in the past couple months because I was talking about this, and people coming out of the woodwork saying, oh yeah, I have all these symptoms. I have functional neurological disorder. I have POTS. I have MCAS. I have all this stuff going on. I have headaches. I have ringing in my ears. I have muscle weakness. I have visual issues. I have migraine headaches. But my MRI either showed nothing. They said it was normal. And it was a laying down MRI, not upright. You have to be upright to see it. It changes a couple of millimeters of position when you lay down. But also, maybe their MRI said they have low-lying cerebellar tonsils or mild tonsillar ectopia, and it's 3 millimeters. Well, any amount of herniation is still meaning that the hole in your base of your skull, which should only have one thing, brainstem and fluid, instead has brainstem and brain. It is crowded at any amount of herniation. This is just like logic. So it's going to mess with the fluid flow, which is trying to bring nutrients to your brain tissue so you can have like a lot of weird neurological symptoms and brain fog and chronic fatigue, because literally your brain tissues aren't getting the nutrients and the metabolic flushing that they're supposed to because the fluid's stopped up. And also your brain, the part that's herniated, is the cerebellum that affects sensory processing. So we see a lot of like hypersensitivity to light, sound, touch, like hyperreactivity. We see motor, like muscle weakness problems. We see emotional dysregulation. We see a lot of brainstem related symptoms because they're literally squished. And so it's crazy to me how many medical doctors, neurologists will tell their patients, no, that couldn't possibly be causing your symptoms. Like, I had a woman come to me with these symptoms. I saw on her laying down MRI, she had like a 3 millimeter herniation. I started alleviating the tension in her spinal cord through the fascia, through the DFKC, neurofascial kinetic chain, and doing the nervous system regulation stuff. She got way better. She went back to her neurologist and he's like, that's not possible. That isn't related. We still don't know what caused those symptoms, but it definitely wasn't this. So for your people, who have these kinds of symptoms, especially if they're mysterious and nobody knows what's causing them, there's a good chance that you actually might have cerebellar tonsillar ectopia is the technical anatomical term for it. And you need an upright MRI to see it. But also, if you don't have an upright MRI near you, you could just try doing the nervous system regulation and alleviating the tension in the DFKC and see what happens, because it's not going to hurt. The whole point of this neurofascial flow method is it's created to work with your nervous system, and it's very trauma informed. And it might help, it might make a big difference. I mean, I've seen a lot of people go back to work who were forced into early retirement and disability. We don't even have enough time for me to tell you how dysfunctional I was and how functional I am now. It's gonna make me cry because it's just, there's so much deep, profound suffering that so many of us have been experiencing for so long, and just getting passed from specialist to specialist who don't know what's going on. And, a lot of times they're just like, well, it's all in your head. You're just stressed. And it's like, actually, it's not all in my head. That's literally the problem. It's a brain herniation. But it doesn't need to be as scary as it sounds, because I didn't want the invasive stuff, and I created this non-invasive method to alleviate it. And it's worth trying, whether you think you have this or not.
Amazing. So is there a number one thing that you teach your clients for healing, or a really good place to start?
There sure is.
The foundation for all of this.
Literally, the foundation for everything is about creating safety and change receptivity in the nervous system. Like, we all know about psychological safety, like feeling safe to take interpersonal risks, to speak up, to disagree openly, to surface concerns without fear of negative repercussions and needing to sugarcoat bad news. But what we create when we work with the neurofascial kinetic chain is somatic safety, where the brain and the body are safe to signal to each other and make adjustments in real time. When you have this like brain first approach, oftentimes the body isn't given enough of a voice when there's a lot of like just somatic or psychological only approaches to healing from chronic stress in the body. So when you work with the body and the nervous system at the same time by literally reading the physiological signs that your body has, this is what I was talking about earlier, where I say, and it's literally like the foundational lesson for all of Neurofascial Flow, is being able to read your body's signs of going into sympathetic engagement. Because you might be, pushing harder than you need to say, yeah, I can make an extra meal for the neighbor, or I can watch my sister's kids, or I can whatever, but it's at the expense of engaging your sympathetic nervous system. And so when you learn how to be able to tell, just like a musician can tell if a note is a little sharp or a little flat, the more you practice this skill, you can tell when your nervous system starts to go into that sympathetics just habitually, and you can make a different choice. Not that you never do that. If you need to push through and do a deadline at work, you do it, but at least you have the awareness of it. And you can make different choices in your lifestyle, and also when you're on the massage table or doing PT or doing fascia release on yourself. This is how you're going to be able to modulate and work with your nervous system instead of forcing change.
That is incredible. Absolutely incredible. I have no doubt there are a ton of people right now that really want to get in touch with you or learn more about what you do. Can you just give us a bit of an idea of what you offer, how you work with people, what you have available?
Sure. Well, the biggest thing I've been focusing on right now, because I walk my own talk and I am not currently seeing, excuse me, this light is really throwing.
That light is
hang on, I think I can close this. It is. I'm like, it's so distracting. I keep trying to move to get the sun to stop. Okay.
You've been doing really well. You've been rolling with it. Like, I'm under attack, but I'm going.
Okay.
Okay.
Oh my God. How did I not stop it? Oh my God. Oh my God. All right. Hang on. Up with that. Okay. Oh no. I don't even know where it's coming from. The blind is closed.
Something somewhere.
Right. I'm gonna stand up. Oh my gosh.
There we go.
Okay. So
you're a trooper. Where were we?
All right. I'm just gonna start over with my answer. So I am currently focusing my efforts on getting this information out to as many people as possible. And in the past, I've had patients come to me from all over to work with me in person, but I know that the majority of the results come from things that you can do at home on your own. And so I used to teach workshops live, recorded them, and turned it into an online platform where it's like there's a ton of follow-along videos, it's very detailed, and it's not a protocol because I don't think that we respond well that way. Everybody is different, and so it's more of a choose your own adventure. I've created like a little healing map and how you can interact with trying different things in the program and learning how to read your body's signals while you unravel all of the sticky places in your body and get back to physically fluid so that you can be neurologically adaptable. That is a community platform where I do monthly calls. We have a private group, so I tap in there and answer questions, and that's the very best way to be able to work with Neurofascial Flow method. I am, doing my best to make it accessible and focusing also a lot of effort on training healthcare providers. So if you're a healthcare provider who wants to learn this, or someone who is receptive, like I'm on a mission to elevate the standard of care. This needs to go out much further. And also, if you know any researchers, we need more research. I'm happy to collaborate. But that's not my specialty. So I've done my best there, but we're working on that as well. And occasionally we also do healing retreats as well. But the way to find out about that is it's just exclusive to people who are members inside the Chrysalis. So I will give you the link for Inside the Chrysalis and put that here, as well as the self-assessments. Once we have that up and running, I'm sure we can add it into the description on this. But yeah, the membership program is, come for a month, come for 6 months, however long it feels useful to you. I would say most people end up moving through this process in the 3 months to a year, depending on what's going on in your system. But that's where you can come and get the support and be able to take more control over your health. Because I don't want you to just blindly listen to me or any doctor, including me. It's more about giving the power and control of your health back to you.
Dr. Satya, this has been absolutely incredible. I have learned so much. I really appreciate how you've explained everything. Thank you. Thank you for doing this.
You're so welcome.
Really great to have you here.
Yeah, it's delightful. And can I just say, because you said it was fascinating a couple times,
Yeah.
I would say it's fascinating.
Of course you would. You've been biting your tongue on that one for a while.
I was like, oh, I just gotta.
I can't end this without me getting that in there. Amazing. Well, people listening, watching, everything you need to know to get in touch with Dr. Satya is in the description. I really encourage you to take a look and check out what's there, because she's clearly a wealth of information and knowledge. Thank you for watching. Thank you for listening. And I hope to see you in this next one.
Thank you.